My name is Jaime Moreno. I am the chair of emergency medicine. I'm the medical director of the Sinai ER, and I've been here almost 7 years. I knew I was going to be a doctor since I was probably 5 years old. I was that kid saying, I'm going to be a doctor. I was in first grade, second grade. I always said I'm going to be a doctor. I have family physicians, not in this country, but from Mexico. Half of my family are physicians, so kind of always had that, I guess, in me. But then growing up, it really made me believe that was what I was meant to do. Growing up with parents that didn't speak English and going to doctors and just seeing how hard it was for them to navigate and the comfort level they had or did not have with the whole system. So, that always just propelled me to become a physician so I can be there for my community, for my patients, and that was always my lifelong dream. Growing up in Pilsen, I'm a local product, so I've seen these neighborhoods, I've seen them change. Pilsen is a very Hispanic, Spanish-speaking neighborhood, so that's always been near and dear to my heart, staying in a community like that. So coming back to Mount Sinai was exactly what I always envisioned. Working in a hospital where there's so much need and you're just taking care of people that are, that lack resources or, don't always trust the medical system. They need more education about it. I feel like I can make a very powerful impact when I see patients like that. So Sinai is just, I always feel like Sinai is a place where I'm meant to be. A lot of, for example, just kids and families that I see just remind me of myself growing up, remind me of my family growing up. So, I understand a lot of their challenges. I can speak to them and I know what foods they're eating. I know what stores they're going to. I know what's affecting them sometimes. I know we're all, I can't identify with every single patient, but I have a pretty good idea, and I feel like that puts me in a unique position where I can actually communicate with them and just, make them understand things a little bit differently, and I think that really is impactful. For me, it's when patients literally just tell me that day as they're leaving the ER or they're getting hospitalized, and they tell me, thank you for helping me understand, or thank you for talking to me in a level that, that I don't really have a lot of questions. I know what's going on. Nobody's ever explained this to me this way. I love hearing that. I feel like I do make a difference every single day.